So do we actually need to know what type of heart disease is causing a murmur, or what's even responsible for a murmur in the first place? Well, probably diagnosis is less important than being able to assess the risk of cardiac complications. So we will need a specific diagnosis if we need to start some sort of specific treatment. So that means for hypothyroid cats, we absolutely need to get a diagnosis. In hypothyroidism, some cats will go on and develop secondary structural heart changes. Other cats may just have a murmur associated with an increase in cardiac output. Diagnosis is much easier for hypothyroidism than it is for many cardiomyopathies, because we can look at clinical signs, we can often palpate a goiter, and we can measure T4 levels. And specific treatment is certainly needed. So for hypothyroid cats, we'll want to treat the hypothyroidism. With systemic hypertension, we're going to need a specific diagnosis. And fortunately, measuring blood pressure is relatively easy in cats, and blood pressure should be measured in any cat that has a heart murmur. And specific treatment again is needed for cats that are hypertensive, and amlodipine is usually our first choice treatment for lowering blood pressure. With congenital disease, we may need a specific diagnosis, and this can be really challenging. So this is a job usually for specialist cardiologists, because with some congenital conditions, there is a treatment available. So with this cat, Harry, he had a double-chambered right ventricle, he underwent open heart surgery, and has done very well for a number of years without any medical management at all since his surgery. So identifying a specific congenital problem can make a big difference because there's specific treatment that may be available. But for most other cats, it's probably more important that you identify which cats are headed for problems. And identifying the specific type of cardiomyopathy is less important than being able to identify cats that are at high risk for developing problems like congestive failure or thromboembolism. So for cats that appear to be free of any problems, that appear healthy to the owner, but where you suspect heart disease, we know that some of those cats may be headed for congestive heart failure, some may develop aortic thromboembolism, and some may even die suddenly. But for many cats, they'll do quite well, even with underlying cardiomyopathy. So in this study where we followed cats with hypertrophic cardiomyopathy, even after 5 years or so, less than 50% of those cats had actually died of their cardiac disease. So some cats can manage and don't seem to be at risk of developing life-threatening complications, but some cats do.